Hello everyone, welcome to my YouTube channel New Info. First of all, like, share and subscribe my channel and hit the bell icon. In this video, we will be talking about cardiac arrest. We will discuss what is presentation and cause of cardiac arrest and how to approach a patient with cardiac arrest and how to perform CPR. Today we are going to discuss all this. First, what is cardiac arrest? Cardiac arrest is basically sudden loss of consciousness with absent major pulses. There is no breathing, and death is inevitable if not treated. Now, what are the causes of cardiac arrest? It can be due to ventricular fibrillation, or it can be due to asystole, and it can be due to electromechanical dissociation. What happens in ventricular fibrillation is that there is abnormal electrical activity in the ventricles that does not let the ventricles to contract properly and push the blood out the body, so that the pulses are absent and there is no blood supply to the brain and to get unconscious, and breathing will stop. It is the most common cause and most easily treatable cause. It occurs due to myocardial infarction, ischemia, electrocutions, and can cause ventricular fibrillation and cardiac arrest. Second one is asystole. In asystole, there is no systolic contraction of the heart. Whenever there is no systolic contraction, there is no blood pushed out. There are no pulses. It is due to the failure of conducting system and it has poor prognosis. Now, what happens in electromechanical dissociation is that either you see normal electrical activity when you do an ECG of a person, either you see the normal activity but pulses are absent, or even you see abnormal activity but pulses are absent. A pulseless activity is reached, so that is called electromechanical dissociation. It can occur due to cardiac rupture or massive pulmonary embolism. Whenever a patient presents to you with cardiac arrest, you must remember irreversible damage if circulation is not restored within 2 to 3 minutes. So you must attempt to restore the circulation within 2 to 3 minutes. First, you should confirm the diagnosis whether the patient is having cardiac arrest or not. You should see the patient is conscious or not. The patient should be unconscious, there should be no breathing, and pulse should be absent. You do not check the pulses in radial artery, you check the major pulses carotids, because sometimes when the patient is hypotensive, these pulses get absent, but in hypertensive these pulses will be present. So you check the major pulses. If the major pulses are absent, then make the diagnosis of cardiac arrest. Now, how to perform CPR? You positioning the patient on firm flat surface with the patient's face upward. Look, listen and feel for breathing. Basically, when you check for carotid pulses, you check the carotid pulses for 10 seconds, not more than 10 seconds. If no pulse is found, start chest compressions. Perform 30 compressions and 2 ventilations, breaths, and you repeat the cycle. Now, how do you give chest compressions? Basically, what you do is you put this part of hand slightly above the zippy sternum and you place your second hand like this and you push the heart. Remember, you have to keep your hand straight. You do not bend your elbow so that the weight of the body will help the chest compressions. So depth of the compression should be 2 inch or 5 centimeter. Allow the chest to recoil between the compressions. And do not take your hands off the chest and shoulder should be directly over the sternum. You have to provide 30 compressions and 2 ventilations or breaths. If you are in hospital facility, you will have facility of ombo bag. If you are outside the hospital, you should provide the breath through mouth. A cycle of CPR should be of 2 minutes. Most of the patients get cardiac arrest outside hospital facility and you provide this management outside. But if you are inside hospital facility or patient have reached the hospital, ECG machine, defibrillator and cardiac medication must be there. You apply the ECG machine and you detect the abnormal rhythm. You bombard that abnormal rhythm with defibrillator and you stop that the abnormal rhythm with defibrillator and you also give cardiac medications to help heart to push blood out of the heart and generates a pulse. Remember, these chest compressions only help the circulation of the blood in the body. They do not stop the abnormal electrical activity of the heart. If there is serious arrhythmia, that is ventricular fibrillation, asystole, there is vertically no survival if heart electrical activity not restored within 10 minutes. Chest compressions only perfuse the blood to the vital organs. They will not stop the arrhythmias, so chest compression only help perfusion of the body and they give you some time to perform defibrillation and stop these arrhythmias. Now, if the patient has cardiac arrest, you perform ECG. You can get rhythm like this. This is ventricular fibrillation. You can also see the ventricular tachycardia. If a patient is having asystole, you see a flat line like this. This is because there is no systolic contraction, no electrical activity, and a flat line will be shown. Electromechanical dissociation can present to you with either as normal ECG or an abnormal ECG, but the important thing is pulse. The pulse will be absent. Patient will be having absent pulse and electrical activity will be present. Thanks for watching this video.